First up at 4, the Carolinas continue to see record COVID spread. North Carolina's case counts above 10,000 today, bringing the 2-week average for daily new cases above 10,000 as well. Now, this is a new pandemic record for the state. When we talk about these daily averages, the percentage of tests finding an infection also skyrocketing. Over the last 2 weeks, nearly 1 in 5 people tested are positive. South Carolina also setting new highs. DHEC says more than 5,000 new cases today, but the weekly total, which tops 50,000 cases, is the highest case week of the entire pandemic. Yesterday, the state reported 1,200 patients in the hospital with the virus. Now, unlike the start of the pandemic, doctors say these numbers are not skewed towards any particular age group. Everyone, even kids, is susceptible to catching it because it is that contagious. We're talking about that Omicron variant. The American Academy of Pediatrics reports cases among children more than doubled in 1 week's time. WCNC Charlotte's Chloe Leschner live for us at StarMed on Tuckasegee Road. We know the timing of this too, kids trying to get back to school. What do parents need to look out for?
Hey, Vanessa, doctors say anybody who has a fever, is congested or has a sore throat should just assume they have COVID, even if they can't get to a clinic like this one to get a test to confirm it. But a pediatrician with Atrium Health says it does get tricky with kids because they are more likely to be asymptomatic. With a big rise in COVID cases comes concern for some of our littlest.
And as we're seeing nationally, the numbers of positive cases in children that are reported daily or weekly far exceeds anything we've seen in the past during the pandemic.
Dr. Amina Ahmed, a pediatric infectious disease expert with Atrium Health Levine Children's, says kids are more likely to be silent spreaders. The return to school from winter break could add fuel to the fire.
What we're seeing locally is that the percent positives in children are higher for the children that are asymptomatic, probably being tested for exposures, than even the symptomatic.
They're preparing to see more kids requiring hospital care, which typically lags a few weeks behind a sharp rise in cases.
COVID pneumonia?
COVID pneumonia.
Are they prone?
They are prone.
Doctors say having as many students as possible fully vaccinated and boosted is even more important now.
You ready?
Pfizer boosters will likely be fully approved for kids 12 and up later this week, shortening isolation periods for more kids. Based on the latest CDC guidance, kids who are fully vaccinated and boosted when eligible don't have to stay home if they're exposed. Just wear a mask for 10 days. And those who test positive can go back in person sooner if they're not showing symptoms.
These kids that are down to age 12 can fall into this fully vaccinated group of the boosted people, and then can possibly return to school sooner. So it's going to be important for schools, but also just for the community.
So this is a look at the testing line at StarMed's Tuckasegee Road location right now. You can see another very, very busy day here, and testing capacity is really strained pretty much everywhere in the country and here in Charlotte too. So providers are asking for patience, and a reminder, if your kid is showing symptoms or not feeling well, do not send them to school. Live in Charlotte, Chloe Leschner, WCNC Charlotte.
Chloe, thank you. And of course, with more and more school districts returning from winter break, we know that some have mask policies in place while others do not. And there have been some changes too. It can certainly be confusing to try to keep track of all of them. So to help, we have put on our website a breakdown of all of those guidelines by district. Just go to WCNC.com and scroll down to the featured section.